My topic today is understanding all about HPV vaccination. I'm Dr. Rekha Thakur and I'll take you through this topic with a purpose of prevention and protection from HPV related diseases. So to begin with, what is HPV? HPV stands for Human Papillomavirus. It is a virus which causes sexually transmitted diseases. It is transmitted to one another through sexual contact. And HPV is responsible for cervical cancer and many other cancers which include anal cancer, vaginal cancer, oropharyngeal cancer, vulval cancer, penile cancer, and many other cancers, and also many sexually transmitted diseases and genital warts. So here we are looking at a broader picture of HPV related diseases and how we can protect ourselves from HPV related virus. So the best thing is we do have HPV vaccination available with us, which can protect us and our friends against HPV viruses. And the best thing is we have HPV vaccination available with us, which can protect us from these HPV related diseases. So what are these vaccines and what is the ideal time to take this vaccine is what I shall highlight today. So what is the ideal age? The recommended age is from 11 years to 45 years. And the best time to take vaccine is from between the age group of 11 to 14. And the idea behind this is to vaccinate every girl and boy before they start their sexual life. Because HPV virus is transmitted through sexual contact, and by vaccinating them at a right age of 11 to 14 years, we are protecting them from the virus even before they are exposed to the virus. So the ideal time is between 9 and 14 years, where they need only 2 doses of vaccine at an interval of 6 months. So between the age of 9 and 11 years, 2 doses of HPV vaccination is recommended. And beyond 14 years, so from 15 years onwards till the age of 45, 3 doses of vaccine is recommended at an interval of 0, 2 and 6. So if you take the first vaccine today, the second vaccine will be at an interval of 2 months and the third vaccine will be at an interval of 6 months from now. So the 3 doses for age groups beyond 15 years. This vaccine is recommended for both men and women. Both boys and girls can take this vaccination. We are only talking about girls because it gives protections from cervical cancer. But when we look at a broader picture, the vaccine gives protection against HPV related diseases. So HPV related diseases prevails in men and women both. So the vaccine can be given to both men and women. In men, it protects them from penile cancers, genital warts, and many other cancers like oral cancer, anal cancer, oropharyngeal cancer, throat cancers. So even they have protection, and they also can prevent sexually transmitted diseases to their partners. They contribute to the herd immunity. So boys should also consider this vaccination. What are the vaccines available with us? There are 3 different types of vaccines available. Then the first one is HPV 4 variant, the second one is HPV 9 variant, and the third one is an Indian vaccine recently launched by the name Servavac. So the first one, HPV 4 vaccine, which comes by name Gardasil 4, works against 4 different strains of HPV virus, number 6, number 11, 16 and 18. So it gives us protection against cervical cancer and genital warts. Whereas HPV 9 variant, which is Gardasil 9, gives us protection against 9 different strains of HPV virus. So in addition to the 4 variants, which is number 6, 11, 16, 18, in addition to these 4, it also protects us against 5 more high risk HPV variants, which are number 31, 33, 45, 52 and 58. And these high-risk HPV strains are responsible for many other HPV-related diseases like cancers and sexually transmitted diseases, warts, and many other skin lesions. So any day, HPV 9 variant is a higher category than HPV 4 because it gives us expanded protections against multiple HPV related diseases. The only challenge between the two is the cost. HPV 9 variant, Gardasil 9, is much more expensive than HPV 4 variant, which is a Gardasil 4. So if cost is not a challenge for you, always go for HPV 9 variant, because it gives you a better and a better protection and expanded protections from multiple diseases. The Indian launched vaccine Cervarix is very reasonably priced, and it's the same as HPV 4 variant, gives us protections from HPV variant 6, 11, 16 and 18, and it protects us against cervical cancer and genital warts. So you can also opt for Cervarix. Is there any side effect of these vaccines? No. The only side effect that you can feel is little pain in the arm, mild pain for a day or two, or mild fever, but otherwise it has no major side effects. The side effects noted maybe in an immunocompromised people. So when we give vaccine to people who have very low immunity, or people who are undergoing any cancer treatment or any therapies with immunocompromised status, so they should take the vaccination in the hospital under supervision and only after consulting their doctor. So with this, I recommend that all of you please take the vaccine. The early, the better. The best idle age is between the age of 11 and 26. So if you have any questions related to HPV vaccination, get in touch with me. You can put your questions in the comment box and I'll get back to you. Thank you so much.